So I wanted to talk a little bit about neuroscience and a technique that I use with my clients often when they come into session and they're dysregulated. There is a researcher named Porges that came up with something called the Polyvagal Theory. And what he talks about is just that basically a window of tolerance that we all get into. So if we're dysregulated or a little bit upset, when my clients often come in, they are. And what I do is I try to teach them a basic technique, which is I'm going to walk you through today. So what basically Porges talks about is he talks as something, the dorsal vagal vein that runs through the front of us. So there's the ventral vagal, which is the part of our brain that says things are good. These are the highlights, these silver linings. The middle part of this is the sympathetic nervous system that keeps us into fight, flight, or freeze. And then the bottom part is called the dorsal vagal nerve. So when we're dysregulated, when someone comes in, I say to them, gauge where you are. Are you feeling kind of connected to yourself and feeling pretty good? That would be the ventral vagal. And at the ventral vagal, what you're doing is you're remembering things like maybe the nice walk that you had today, or maybe a memory with your family, or maybe a really nice vacation, or a spot that you really love going to when you want to relax. The sympathetic nervous system is kind of like I'm in fight, flight, or freeze. You know, I'm kind of gauging a situation to say, can I relax? But I'm kind of not so sure about it. And the dorsal vagal is actually when you're frozen. And in that space, that's when you're kind of stuck with memories. You're thinking about difficult times, and you're at the point where you're not really moving. So those are the points where you're kind of in that frozen state. So what I do when people come in is I try to work with them and say, where are you on that ladder of the vagus nerve? And if they are in the dorsal vagal, what we do is we try to make them move. So I'll do simple things like say, okay, get up, walk around the room, touch a couple of objects in the room, tell me what you're touching, what is it feeling like, and what that does is that gets them, first of all, moving, but it also gets them in contact with the present. And the more that they're able to do that, maybe they're able to pop up into the ventral vagal, which is kind of a nice place. So if people are really frozen and we pop them up into the sympathetic, then what we're trying to do is to get them into the ventral vagal. And that's when I say to them, okay, do you have your phone with you? Can you bring up a couple of your favorite pictures? So maybe if they're pets or if they're children or of scenery, and they pull it up and they look at it for a bit. At which point they are starting to really think of the things that make them happy. So all of us have those things, but we just get disconnected from it. So what I often say is trying to figure out that ladder on the vagus nerve is really important. So it's something you can try at home. Kind of think, what am I feeling? Is it that I kind of feel a little bit frozen or just kind of really getting disconnected from my body? I haven't been moving. I'm kind of stuck with, some sad feelings. And then you're in the dorsal vagal. So you got the lower end of things. I mean, kind of a little bit, anxious, but not really sure. Then you're in the sympathetic, fight, flight, or freeze. And start to think, okay, what can I do to get myself a little bit more comfortable and understand where things are at for me. Or if I'm in the ventral vagal, which is great, then I am in the space where I'm thinking of all those silver linings, which is gratitude, which is the basics. So the more we're able to kind of recognize where we are, then we're able to help ourselves along the ladder. So what I'd like you to do is to challenge yourself to try to think, where am I on that ladder? And if you'd like to learn more about it, you can go to Porges, which is spelled Porges, and the Polyvagal Theory. And there's a lot, you can probably look up a lot of it on YouTube and learn a little bit more for yourself. So this is Roxanne Gerhardt of the Authentic Connection Movement. I'm a mental health and wellness specialist. If you're needing anything around the areas of keynoting, training, or speaking, please contact me at roxannegerhardt.com. Thank you.